Good evening. I'm Reverend Liz Walker, pastor of Roxbury Presbyterian Church, and we welcome you to tonight's town hall presented by the Cory Johnson Program for Post-Traumatic Healing, part of our ongoing series, Coping in This Season of COVID-19. Joining me to help facilitate tonight's conversation is my sister on this journey, Reverend Dr. Gloria White-Hammond, who is co-pastor of Bethel AME Church, a pediatrician, and the Swartz Resident Practitioner in Ministry Studies at Harvard Divinity School. The subject tonight is kids and COVID. What's a parent to do? And a quick note, this town hall is being recorded and will be made available on our website at rpcsocialimpactctr.org.
Well, thank you so much, Reverend Liz, and it's great to be with you again tonight. And really grateful for all those who are in attendance. We've been dealing with COVID for a while, and so the old news is that we are very much in the midst of COVID. But the new news is that, unlike the earlier days, children seem to be much more affected than they were previously. According to the CDC's report last week, children make up 26% of those who are affected by COVID. And we want to understand what the situation is in Massachusetts with our children. What is the risk to children, and what can we do to protect our kids? I'm sure that there are a number of people out. I can see we're up to 35 participants, and if you have questions, please be sure to write those in the chat. We'll get to them as quickly as we can.
We want to welcome our very special guests who are very busy, who have incredible credentials. We're not going to mention all the things that they have done, just enough for you to know that they should be here. First of all, Dr. Larry Madoff, who is the medical director at the Bureau of Infectious Disease and Laboratory Sciences at the Massachusetts Department of Health. Dr. Jeanette Callahan, a pediatrician, was part of the Cambridge Health Alliance and also one of the founders of the Wellness Collaborative in Roxbury, where she's going to tell us more about the Wellness Collaborative tonight. Michael Cory, the president and CEO of the Massachusetts League of Community Health Centers and a community activist. And Dr. Fanta Atkinson, a clinical psychologist who works at the Cambridge Health Alliance. We want to thank you all for joining us, and we have much ground to cover tonight, so let's get started. And Dr. Madoff, I'm going to begin with you because you represent the broadest overview. So if you could tell us what the state is doing to support our schools, and are there any special precautions and monitoring that are underway right now?
Well, first, let me say thank you, Reverend Walker, and for inviting me to join tonight. And it's really a pleasure to be here, and I appreciate the chance to talk about this. I know, and also to my to the other panelists that are here tonight. Hi, Michael. Nice to see you again. And it's I would say that it has been a priority for Massachusetts to get kids back to school. We know how much opportunity was missed when so many kids were attending school remotely. And we can talk about some of the downsides of that and the upsides that we know of having face-to-face interaction and having kids be together and be with teachers face to face. And so the Commonwealth has really worked hard to prioritize that. I think, I want to say that, and we'll talk more about the vaccines for COVID, but we're really fortunate that, this year looks different than last year in large part because there are vaccines that are safe and effective. And because so many people in the Commonwealth have been vaccinated, overall, more than 75% of those eligible have been vaccinated. And even in kids for whom the vaccine for those 12 and over has only in the last month or so been available for vaccination, they've been eligible to be vaccinated. Nearly 70% of kids, both in the 12 to 15 and the 15 to 17 age groups, have already been vaccinated in the state. And those are as of maybe a week ago. So I expect that we're even higher than that by now. And so, making vaccines available, making them as widely and easily available as possible, getting them out to the communities that need them has been a real priority for the state. And I think that by having a heavily vaccinated population, we're seeing the benefit of that, even though we're having a surge, and we're seeing the Delta variant that's been spreading widely and has been spreading in kids as well as in adults, and we're seeing far less of it than we would have been seeing if the population wasn't so well vaccinated. And I'm going to say this many times tonight, but if you haven't had a chance to get vaccinated, please do. It's something that you can do for yourself to keep yourself safe, but also to keep those around you safe. And I mention it particularly tonight because those under 12 are not yet able to be vaccinated. And so one of the things that we've seen here and nationally is that the higher the vaccination rate is in adults, the lower the rate of illness and hospitalization is in children. And in those states that have high vaccination rates, the rate of infection in children is less than a quarter of that's seen in the less vaccinated states. And so just getting vaccinated, and that has been, such a priority of DPH and the Commonwealth, is to get people vaccinated and make sure that vaccines are widely available, and to promote their uptake. So that's one thing. The other thing that
Dr. Madoff, I'm sorry. You're giving us a lot of information. And so no, that's what we want. But I do have one question. If you just repeat the numbers of kids vaccinated so far, you gave us those numbers and I didn't get them down, or the rate right now.
Yeah. So it's about 70% of those eligible who are under 18 are vaccinated.
Good. That's
fully
great.
Vaccinated. So that is a good rate for it's leading most parts of the country, and we're very proud of that, and proud of the parents for getting their kids in to get vaccinated. So just applause for all of you who've done that.
Okay, well, we're going to get back to those other points that you want to make.
Sure.
Just want to cross over and then come back to you if you don't mind. Thank you. Reverend Gloria?
I do want to ask another question, and we've seen throughout the Commonwealth that in communities of color that our numbers are lower. What does that look like for our kids, for Black and Brown kids?
I don't have those numbers off in front of me, but yes, unfortunately, in under vaccinated communities, kids are also under vaccinated. And we are working hard to do outreach into communities, and the Commonwealth has a very aggressive vaccine equity initiative, and we're trying to reach out to we have a special program for the 20 communities that are most affected by COVID, doing really active outreach and trying to get more vaccination into those communities. But you're right, Reverend White, that is less of a there's less vaccination in those communities.
Yeah. Well, we're certainly here to partner with you around addressing that. I would like to have an understanding on all of you really work with kids on one level or another. What are the biggest concerns for school children this year? Dr. Callahan.
It's like press that button. Yeah, the biggest concern is really for the kids is to get back to hanging out with their friends. That is what they want to do. They want to get some semblance of normalcy. They want to go back to being able to just hang out with their friends. And when I at my clinic, it's always interesting because the parents, they come in and they just say, I'm worried about my kids going back to school. I'm worried. And the kids are usually sitting on the exam table, texting or doing something. And I'm like, are you worried? And they're like, no. They want to be with their friends. And one of the biggest things, I wanted to jump in if I could say about the disparity of the vaccination rate looks really good when you're going across the entire state, but when you focus in, and when you focus in on certain communities, it's really not a good picture. And part of, I can do a plug with what the Wellness Collaborative is doing, which is an organization that really partners with community organizations that convene events, whether they be fashion shows or whatever event it is, and we bring the COVID education to those events. And so we know that what works for communities of color is communities of color organizing and bringing folks together. And so tapping into that resource, because the Black community, the communities of color are, they have a lot that's already going for them in terms of their ability to connect and with the relationships that already exist. So we tap into that. And we bring the COVID vans and the testing and the vaccination and the education to those events. And we've had some really success in terms of increasing the vaccination rates. And just another thing, if I can add, when parents ask me, how can I protect my kids? I talk to them about the vaccine. When you look at Springfield, right? In terms of what the infection rate in Springfield, for just a week's worth of time in the school tracker, there were 70 students that were infected with COVID and 8 staff members. And the total vaccination rate for Springfield is only 66% in that area, in that region. And for 12 to 15-year-olds, only 45%. So it's but do you look at Wellesley, let's take one of the W's, okay? Wellesley, Winchester, okay? Total vaccination rate is 86%. And there are only 2 students infected, no staff members. And their 12 to 15-year-olds are 100% vaccinated.
Wow.
So there is a disparity that we have to share with the community, share with those patients that we see, is that it makes a big difference if they are vaccinated. If their community is safe, their kids will be safer.
Right.
And so that's one thing I emphasize.
I wanted to bring Michael Cory in. Michael, what are you seeing in the community health centers? Are you seeing the same kinds of things that Dr. Callahan just mentioned, the disparities, and how do the health centers work in helping this change?
Yeah, thank you, Reverend. So first and foremost, just credit to you and Roxbury Presbyterian and Reverend Gloria White-Hammond. I know I've been very busy in the last year and a half, and every time I turn around, the 2 of you are leading the charge to educate our communities and to make sure that we all are held accountable to saving lives in and around Black and Brown communities. So thank you for that. And then to Larry, Dr. Madoff made a point. We should all take a moment and pause that we're in Massachusetts and not somewhere else in the country. And even though we have challenges in Massachusetts, even though we have the inequities that are being borne out in the data, there is worse in other parts of this country. So there's some credit to the team at DPH for the tremendous amount of work they've been doing to get resources on the ground, to create collaborations and partnerships like we're seeing that many of you have created. I got my vaccination at a church with a partnership between Boston Medical Center, Bishop Borders, and Morningstar Baptist Church, and Guale and the team at Mattapan Community Health Center, a model for the rest of the country. That we can do a lot of things when we partner. Now, when we talk about kids, what we're seeing, health centers, 52 health centers across Massachusetts serving over a million patients. That's 1 in 7 Massachusetts residents get their care at a health center. And if you're in Boston, that's 1 in 2. What you may not know is that 25% of that patient population are children. And what we're seeing is that children, like we're seeing across the country, are increasingly being infected, particularly with this new Delta variant. And that we're trying to respond not only to the medical condition of being infected, where it reveals itself, but also the trauma of that. We know that any of us in the moment find out that we're positive, all the fear comes on us, right? So not even talking about the physical illness. I had a parent tell me recently, she said, Mike, you don't know how much this has caused trauma in my household, Reverend Walker, as you've done this work about trauma. This is a piece of that. So we're providing information, we're engaging them on this issue of COVID-19. What is it? What you should be concerned about? How you should get the care that you need. But there's a piece that we haven't talked much about, which is that we still have to get them the other care that they need, right? The other immunizations, the other medical care that many of our children need. And as Larry knows, DPH has put a lot of resources into community health centers and others to help get people back into care. Because for a year and a half, people have not received all the necessary care. That's their eyes, their teeth, their overall physical care, their trauma, their substance use. And we're trying to manage a lot of things at one time. COVID-19, children, as well as other immunizations like measles and all those other sequential, these timed immunizations they need, and then also the overall care. So there's a lot that health centers are seeing, but we're telling our patients like Larry and Kevin Cranston, who's also in DPH, we need you to think of COVID-19 vaccines like you think of any other immunization. Get it when you come in for your visit with your primary care provider, your pediatrician, and build this into your normal course of care like you would anything else. And I think that approach is working.
Okay.
Yeah. Thank you, Michael. And just reminding us that those are critical pieces to addressing not just the acute pandemic, but being overall healthy. And so this brings up another conversation, Dr. Atkinson, that there will be relatively few kids who will actually develop COVID-19, but I don't know of any child who hasn't been affected emotionally with regard to COVID-19. What are you seeing?
And, just to reiterate, I think what Mr. Cory was saying earlier about the impact of trauma, I think what we have to remember is communities that are Black and Brown have disproportionate rates of trauma already in the community, and that was prior to COVID. And what we also know is that these communities don't always get the same services. And so what I think I'm aware of is the fact that communities are also impacted by ongoing stressors. So for instance, families that had DV, we all hear about the fact that a lot of DV instances have increased. And so when we're thinking—
what is DV? Dr.
Domestic
Atkinson?
violence, sorry about the acronym. But what I'm very aware of is these children have been in homes that maybe an adult was not getting services for their mental health services, or an adult may have been having increased DV. And so trauma was already there. And then so when these children are already experiencing that, and then they're hearing about loved ones dying, as we know, in the Black and Brown communities, there were higher rates of deaths. And so these children hear about these deaths. And so when they're coming back into schools, these are often children that may have been falling through the cracks. They were getting mental health services maybe virtually, and there was no one with eyes on them. So I'm very aware of the impact emotionally and what happens long-term for these children, and just really trying to get them re-engaged socially with their peers, but also addressing prior mental health concerns, as well as the impact that COVID has had on them.
Thank you. We want to remind you, if you have any questions for anyone on our panel, you can put them in the Q&A part of your Zoom panel, and we can get them directly to them. And I wanted to go back to you, Dr. Madoff. I didn't mean to cut you off. I was just trying to make sure I got all the information that you have. And I do see what I agree with Michael, that you've done such a good job at the state level, but there is a disparity. Dr. Callahan pointed out the disparity. The numbers don't match up. So what is the state doing, or what could the state do on its part of trying to bridge that gap for children?
So thank you, Reverend Walker, and I'll try to address that. It's of course a problem that is not new with COVID. It's a problem that's been with us and unfortunately remains with us. And we at DPH certainly recognize the need to achieve greater equity. I mentioned our vaccine equity initiative, and that has been a big program backed with real dollars and real boots on the ground, people actually going house to house in the 20 most affected communities, trying to do outreach with vaccine. But it's not a problem that we're going to solve tonight or quickly. And I would invite you to engage with us and offer ideas and help us reach solutions. It's a long and difficult problem that we need to continue to work on. But I think measuring it and knowing that there's a problem is always the place to start. And we are doing that, and we are looking at the data and making those data available as widely as we can on particularly racial disparities and ethnic disparities with respect to both disease. And so, that we know that there was a large racial disparity with respect to COVID itself, to the disease. And unfortunately, that disparity is continuing with the vaccine. And we see this again, we see that not just, we see less of it locally and here in Massachusetts, which is a good thing, but it is a big problem nationally. And I think it's important that we first recognize it, measure it, and see what effects we're having. And we're looking very hard at those communities that we're working on through the equity initiative to see what kinds of effects we can have in bolstering vaccination and testing and so forth. I just did want to touch on testing, because that's another way that we're working at the state. We have rolled out pooled testing and made it available for free of charge, or paid for by the state, in now 2,000 schools in Massachusetts. That's more than the number of public schools that there are in the state, actually. And so it's had very wide uptake. And to the extent that parents can be involved with that, please allow your kids to participate in the pooled testing programs where they're available. And that's a way of keeping tabs on finding kids who might be able to spread COVID before they have a chance to spread it, and keeping it out of the schools and keeping the other kids safe. As you know, we are requiring masks to be worn by students in all grades, and that mandate is in effect throughout the state. And masks, I know they're uncomfortable, but I've been amazed at how good kids are at wearing their masks, and I wouldn't have predicted that. It's second nature to them, and they put their mask on and they wear it, and they tolerate it pretty well. So that's another, we are going to continue that mandate at least until October 1st. In October, we are talking about allowing schools that can achieve an 80% vaccination rate in their students and staff, for the vaccinated students rather, to be unmasked after that time. And we'll see how that goes, but that's a plan that's in place. And of course, just today, Pfizer announced that they have good data on younger children, and I expect that they're going to put before the FDA a request to authorize vaccines for the 5 to 12 age group. And that will have the potential for a big impact on making schools safer for all.
I got to follow up real quick. I'm sorry, Gloria, I get excited. I have to follow up. So you're saying you are going to continue the mask mandate in schools till October, and then see if kids can take off the mask? Is that what you said? If the vaccination is up?
So through October 1st, all kids in all schools and all staff are mandated to wear face masks throughout the school day. On October 1st, we're going to assess, it may be possible to, in schools where 80% of all of the people in the building essentially are vaccinated, we're considering allowing students who are vaccinated to be unmasked at that time. But we'll see how that goes. But in unvaccinated kids, and that's going to apply to all kids under 12 for at least the medium term, are going to continue to be masked in schools.
Okay, there's so much confusion about the mask thing, so that's why I wanted to re-ask. Gloria, I'm sorry. Go.
No, that's okay. I do want to follow up with the question that came in to the chat in the wake of your comments around pool testing. How accurate is the pool testing, and does it pinpoint the student or students who tested positive?
That's a good question. So the way the pooled testing works is that a group of students, usually up to 10 students, can submit a sample together. Essentially, each one is sampled, and those samples are put together, and then the whole pool is tested. And if the pool is negative, which 98% of the time it is, then nothing more needs to happen. If a pool comes back positive, we then test the individuals in the pool, the kids. We know which kids are in each pool. And so we'll test all 10 of them, and we'll identify the kid who is positive, and they can be isolated. They can come out of school so that they don't infect anyone else. And the other kids who are negative can return to school. It's just a way of making the testing less expensive and available to everyone, to the million children who are going to school in the Commonwealth.
Okay. We'll have another question, and it may be that several of you would want to respond to it. So what exactly should parents or caregivers be on top of when they're sending their children back to school? Is there some kind of checklist? And if so, what are the items on the checklist?
Well, I think some of that hasn't changed. If your child has a fever, don't send them to school, whether it's COVID, the flu, or RSV, and the number of other conditions that we're faced with in these months. So some of that is basic, that if your child is sick, they really should remain home. In terms of checking in for symptoms, the symptoms for COVID are quite varied, but I think that if your child has a cough, if your child has a runny nose, it's likely that they have the common cold, which is a cousin of COVID. It's a coronavirus, but not COVID. It's hard to know. And so what most schools are requiring is that they see that they either talk to their docs, get a note for their docs to be able to go to school if they have the sniffles, even if they're sneezing. But certainly if I would check your child for any signs of a fever. Vomiting, diarrhea, all on the list of potential presentations, all the GI symptoms, potential. Most likely the kids are not suffering from COVID. We do a lot of testing on kids that have vomiting and diarrhea, and they end up not being positive for SARS. So I think that, and then checking in on your kids emotionally. And, I think that's often, and I'll let Dr. Atkinson maybe jump more in about that, but checking in on how your child is handling going back to school. They spent a couple of years being able to turn off their camera. And now there's no way out. There's no way to get behind a camera and turn it off. So some of those young people who have body image, that have been suffering from body image dysmorphias or any type of illnesses where they are conscious of their own body and their own habitus, right? They can't hide behind a camera. And so going back to school, for those kids, they were relieved. COVID was a relief to be able to not face people if they have social anxieties and that sort. So parents checking in on how their young people are managing, getting back into the classroom and being face to face with their, potentially their bullies, potentially situations that were abated by them actually being home. So we have to truly look at both sides of the coin. There were some young people in my practice that absolutely thrived on being able to govern their own education at home because of some of their other challenges in terms of their ability to socialize and to focus and to narrow in and focus in. Most did not do well. Don't get me wrong, most did not. But we have to sort of have parents understand that their kids are unique, and checking in on them is key, and not assuming that all of them want to jump back into the school setting. So that's what I would say. And Dr. Atkinson.
Just add Dr. Atkinson. Thank you very much, Dr. Callahan. Would you add to that, Dr. Atkinson? I thought Dr. Callahan did a great job.
She did an excellent job. I think there are two sides to this. I think there are children who really are just jumping to be back at school. But I think, as Dr. Callahan highlighted, I think what I'm aware of is children who may have had social anxiety, children who may have, again, speak on bullying, children who may have already have difficulty kind of interacting with their peers will have a huge transitional problem. And I think I suggest parents really checking in with both teachers, talking to the guidance counselors, really speaking to these children. Often already have a clinician that they're seeing at the school, really working out a plan for what that looks like, not waiting until things start to kind of manifest, what you do is you have something ahead of time. So maybe scheduling a Zoom meeting or scheduling a meeting ahead of time and kind of noticing what you're hearing your child say. What are the things they're anxious about? What are the things they're worried about? And already coming up with a plan. Kids, as much as they fight against predictability, they love predictability and they function in a world of predictability. And so anything a parent can do to really help that transition, having regular bedtimes if they're younger children, having the same time to do homework, having meetings regularly with their teachers or whoever their caregivers are that touch base about kind of their mental health needs, anything that you can do to kind of lessen the chaos that's been happening in their life will decrease that anxiety. And everything Dr. Callahan said about kind of just really paying attention to kids who have self-image issues or who have been bullied. Those are all the things you pay attention to.
Michael, I think you had something to add. Excuse me, Gloria. I just wanted to make sure, Michael.
Yeah, so it's interesting. So one is from a provider perspective, and we have at the league, Massachusetts League of Community Health Centers, the benefit of hearing from medical directors across the state, right, who serve very different communities, right? The Russian community in Springfield versus the Haitian community and Cape Verdean community in Brockton. And they're all very unique communities. We often say if you've seen one health center, you've seen one health center, but that's if you've seen one community, you've seen one community. When we think about kids, what we've been trying to talk to is skate to where the puck will be, not to where it is. So when you think about vaccinations and booster shots, we know that inevitably we will be giving out booster shots to that younger population, that younger demographic. We know that there are still some adults and some children in that 12 to 18 range who've not been vaccinated, who are resistant to vaccination. So we still have work to do in that space. And I think one of the things that I think we're trying to figure out is how do you communicate to them, right? We still need to do efficacy and safety. How do you communicate what these vaccines are? I saw some great resources online as I was preparing even for this conversation of really material for the 5 to 11-year-olds that talks about what is coronavirus. What does it mean to have trauma and to deal with that anxiety around disease? What does it mean to be in school and when should you wear your mask and how you should wear your mask? I think we don't have to wait for the clearance to get that younger population to be vaccinated. We can start that now. And what I'd love to see is the very specialized material, so that if you're Brockton Health Center and you have that Cape Verdean Creole or that Haitian Creole material, or name the community, the Dominican community or the immigrant families. Last but not least, it's interesting, we got to reach parents still, because there are many parents who will not get their kids vaccinated because they don't believe in this vaccine or because they believe the fake news they've got online. So we need to have a targeted campaign as we get ready to open this up to more kids that still is about convincing adults. Two, if for those of us who are families of color live in immigrant communities, generally immigrant communities, sometimes the children are the health navigators for the entire family. So we also need messaging that's targeted for children to educate their parents and grandparents who may not have English as their primary language. So there's a lot to be done, but I'm excited that with the partners on the phone and the many others who are engaging health centers, and we've gone in to do vaccinations in schools, it's going to make for a good partnership that we can have the right messaging.
Yeah, I agree with you, Michael, that there's no single way that's going to have the magic impact. We're just going to have to try everything that we can think of and reach out to anyone who we think might have some influence. I think I did want to clarify just something that I thought I heard, which was when you say we're not having to wait for clearance to get vaccinated, we don't have to wait for clearance to be educated, to have to educate kids about vaccination, but the parents, if it hasn't yet been licensed for the younger kids, they're not going to be able to get those vaccinations. We know some parents have been trying to get their kids vaccinated even though it hadn't yet been approved. And it would be great, Michael, if you could put in the chat your references, if you could identify them quickly in terms of parents educating their kids about COVID-19. And the other question I had then is again, is there a checklist? So CDC, I'd encourage you to look at CDC and think about that as your first place to shop for information. CDC actually does have a checklist for parents for their school. You want to know it's not just enough to say kids mask. What kinds of things are they doing to ensure that kids are masking? What kinds of things do they have in place to ensure that there's proper sanitation and that kids are actually able to distance? And then what's the protocol if someone becomes positive? When am I going to hear about that? How do they intend to respond to that? So all of those are important questions that parents should be able to pose and have some answers to when they're sending their children to school.
I have a question from the Q&A, actually, what came through the chat, but the Boston Globe reports Harvard research says that 50% of 16 to 19-year-olds in Boston and 63% of 12 to 15 years old were vaccinated as of 9/11. That's Boston numbers. Are there peer-to-peer efforts or near peer efforts to encourage older teens to vaccinate? Anyone can take that? Anybody know of any programs?
Yeah, there actually are a number of groups I can think of at least a couple of groups of teens who have been educated and been mobilized to talk with other teenagers. I think that there's a group that's actually affiliated with the city of Boston, maybe even a couple of groups. So those groups are out there. Certainly we need even more people to pass the word. And again, we know that the people are most likely influenced by people who they know, who look like them, and who have a similar story to share.
Okay, anybody else got any? I think there's another group out of the Boston Medical Center as well, some young people. So there are many groups that we are aware. Anyone else have any things to share on peer-to-peer groups? Because that's that innovation, I think, that would help the state and would help the community health centers. It's a great idea. I've wondered about if the masking is so important for right now, and this is a question to everybody. How do we know that our kids are keeping those masks on the playground and or on buses or on those other spaces? Or is that a major concern for anybody, or is that something that schools are pretty much handling? Does anybody have any thoughts about that? Dr. Madoff, maybe, or?
It's challenging for educators. It's, one more thing that they have to do, and on top of an already very busy day. Just to clarify, we know that being outdoors is much safer. That transmission out of doors just occurs less frequently, and that's important. So that, and we know obviously kids need to take their masks off to eat, and we try to keep greater social distance during those periods of time. So it is, it's the kids monitoring each other, it's the teachers monitoring the kids, it's other school staff that are keeping their eyes open and reminding kids to do it. And it isn't, I do want to acknowledge, and somebody said this in the chat, it's not easy to wear a mask all day. And we know that you were asking a lot of our kids, and we all know that when we wear masks, it's we come home and take them off, and it feels it's a sense of relief, and I'm sure our kids feel that too. We know it's asking a lot, but it's so important, and it's so effective in preventing transmission.
Dr. Gloria, did you want to pick it up? Because
yeah, no, you're saying this, and I'm thinking of all of the young people that I've seen outside of high schools and junior high schools and on buses, who are ain't nobody trying a mask. And so it's very difficult, but that underscores again the importance of vaccinations and adults modeling what that looks like, and probably Uber modeling in terms of their adherence to masks and hand washing, and again, if you're sick, and what we do know is the symptoms that were yesterday's cold could be today's COVID. So parents need to operate with a lower level of suspicion, and if you're concerned that the kids are sick, it would be better to keep them at home until we have some clarity on where those symptoms are going.
This was a question for Dr. Callahan. We talked a little bit about this when we had a conversation before. What kinds of other related issues are you seeing? I think you mentioned obesity, that kids you're seeing some other symptoms of other things. Could you share those with us that kids have had to go through for the past year and a half?
Oh, absolutely. So basically it's, you hear about the freshmen 20 or 10, whatever, there's the COVID-10. I mean, we had so many children because they were sedentary and they were home in front of their computers, gaining at least 10 pounds, sometimes 20 pounds over the course of this 18-month period. And so we find across the board, not just for children, but for adults, that obesity is on the rise. It wasn't good for this country at baseline, okay, but now it's even worse. So we definitely see that. I also, outside of a lot of the mental health issues, some of the more basic, asthma and things of that sort, we actually did a lot of telemedicine. So I was very busy for the 18 months that everyone was, quote unquote, shut down. And we did manage a lot of some of the illnesses that we see on a regular basis. We were able to manage and able to see them if need be. But obesity is one of the bigger ones that we didn't do well preventing. And so we're seeing that. The other thing is the addiction to social media, and I'm hoping that we can get to talk a little bit about that. But I call it addiction because the kids actually respond to the taking away of devices like an addict would, someone who is addicted to a substance. When you take away that substance, the anger, the irritability. I've had kids kick down doors, in anger and agitation. And so that is something that we're seeing as kids are coming back into the clinic, parents who feel that they have lost control of their child's attention on the things that they needed to be attending to. I hear statements from parents saying, I can't take it away from them. And we're not talking about 26-year-old, people that parents might be afraid. We're talking about 10, 11, 12-year-olds, 13-year-olds who have become so attached to that way to interact with society, to be socially connected via their devices. And so that is a big problem. And unfortunately, I have to sort of come down hard on my advice about that, is to just take it. You really do have to give that child's brain a rest. I don't know whether we're going to talk a little bit about other things that parents can do in a very basic level to keep their kids safe and healthy. We give vaccines. Vaccines boost an already existing immune system, correct? But if that immune system is weak, if that immune system is not fortified with all the building blocks that are needed, then it's like boosting someone to stand who's paralyzed from the waist down. You've got to fortify that child's general health and well-being. And I think that making sure that we talk about the importance of sleep, the importance of good nutrition, the importance of even vitamin supplements. We talk about vitamin D and vitamin C, vitamin A. These are all things that kids needed before COVID, right? This is how we build a healthy immune system so that we can give that army the tools, give them the targeting paraphernalia to fight COVID. But if we're not taking care of our kids at baseline in that way, so parents can do some very basic things to help their children be safe in a time like this. But it does mean going against some of the trends, especially around the use of social media, and kids that take these devices to bed with them. I mean, they literally they send their last text, and then the parents are saying they can't fall asleep. Why can't my child get to sleep? They're up until all hours of the night. So I just wanted to do a pitch for that, because that's a preventative, that's a means of prevention. That's something ever so basic as pediatricians that we've always talked about, helping their children to develop habits that are going to benefit them down the road against COVID and against whatever else there is to come.
That's really scary to me, because overall, at least anecdotally, parents didn't have control over their kids' social media before COVID. So I don't know how we're going to have that right now, but let's open the conversation up for that. I mean, what do the rest of you think about this notion of there's so much misinformation on social media? What can we do to kind of help our children navigate that? Do we just take away the devices? Anybody else?
You know, just discussing social media, I think it's obviously, I think the cat's out of the bag with some of this. I think partially, even kids that are moving back into in-person learning, there is some component of them having to be online, right? So I think there's no way to completely kind of cut your kid off from being on social media for especially older children. I think what parents really have to do is kind of talk to their children and have rules about it, you know, have blocks and safeguards on their media so that children can't access any and everything. I think really talking to kids about what the expectations are. I think when you talk to children about COVID, oftentimes when there's trauma, when there's something that's difficult to talk about, parents can have a tendency to try to not speak about it with children and hope that kids don't really know what's going on, whether it's younger children or older children. I think you meet children where they are developmentally. And so you talk to them about COVID in an age appropriate way. And so, you know, when it's an older child, you can talk about maybe family members that have died and what happened and what's going on in an age appropriate way. With the younger children, they don't understand the finality of death or people that they may have lost because their brains can't wrap around that. And so you talk to them in an honest way about what makes sense to them developmentally. But I think in listening, talking, encouraging expression, I think you have to make space for that. And, you know, with all that's happening, parents are overwhelmed. But even if it's a couple minutes a day, checking in with your child and saying, well, what's happening? How was it to be back at school? What are you noticing? And, you know, being attentive to behavioral changes. Are we noticing children are starting to act differently? You know, paying attention to when kids are more irritable. It doesn't take the same form. You know, when we think of trauma in adults, there are similarities and overlaps, but children manifest things in a different way. And so are they having traumatic play? Are you noticing your children are acting out really violent things or sad things? Pay attention to behavioral changes like that. And so that's what comes to mind when I think about talking to them. It's a global way of talking to them, not about specific things, but really paying attention to how their overall well-being is.
And just to add, and I think to your question, Rev Walker, you know, we know what works, right? We know young people listen to young people. And I think about a good friend of mine, Trina Martin over at BMC, and their youth ambassadors that they use in partnership with the YMCA, and then created a youth advisory board and the TikTok challenge that they have going on, right? So my kids are real big, as most of these other kids are on TikTok. But we know if we can empower kids, young people with information, they're persuasive. But I don't think we're doing it in the ways that we need to yet. And that's here and across the country. So we need to give them the efficacy, the safety, coping mechanisms, all those things that they need to weather, to survive through this moment. And I think we'll find that that's effective. It's always been effective, that they listen to each other.
Sounds really good. There are some questions in the chat that we can go to now. Gloria, did you have one that you wanted to bring out? I don't want to hog the.
No, I mean, we could actually just go right through them. The first one, I think we addressed it. If your child is sick or not feeling well, should we just keep him or her at home? How can parents help themselves? I'm not sure. Certainly, if they're sick or not feeling well, you'd keep them home and then reach out to their clinician, their physician, to get some clarity in terms of how to proceed, whether or not the child would need to be seen and potentially tested. How can parents help themselves? I'm not sure if that means how do parents, if they're feeling, I'm not quite sure what that question means.
I think that's a question that I was hoping would come up, because I think that parents, my parents saying, I'm not doing well through all of this. I'm not good. I'm not okay. What can I do for myself? And one of my colleagues and friends has written an article basically for, Dr. Paul Brathwaite as well, Nicole Brathwaite, I'm sorry, and Charmaine Jackman, both wrote articles about what teachers need to do for their own health, right, healthcare. But if you look at it, parents who are educating their children all the time could actually learn from some of the tips that are being given to teachers and how to get through this moment. Self-care, that's at the top of both lists, is self-care, taking time out of the day to just, for that parent to just have some space to literally be, because the amount of stress and the level of stress hormone is off the chart for parents. And so I think that this person is asking, what do I do to be okay? Having those conversations with other friends, other people who you are close to, keeping those relationships alive and well. If you can get together, stay 6 feet apart with your masks, okay? But begin to really engage with your trusted few, your trusted friends, because a lot of the isolation has taken its toll on the parents as well, okay? Because they've been isolated with their kids. So that is my sense of what that question is, and maybe some other folks can add.
I just wanted to, oh, everybody has, go right ahead. Who was that? Did someone else have something to add there? Well, I wanted to add one thing that just to what Dr. Callahan said. Also, you can go outside, you can take walks, you can, it's so beautiful outside. If you haven't been out, get out. These last few days have been extraordinary, and just breathe fresh air yourself. And that's something you can do, socially distanced with a friend or by yourself. So that's a really, really easy one. Did anyone else have any suggestions how parents can take better care of themselves while they're taking care of their children?
I was just going to echo back to Dr. Callahan some of the advice she had for kids, which is to eat well and sleep well, which is also important for the parents.
Absolutely. Absolutely.
And many parents haven't been doing that even when there wasn't any pandemic. So it's become even more critical now. And I just add to do that in the context of community. That can really make a difference there as well. And then there's a question about that just polls to what extent, and maybe Michael, you can help us with this, to what extent are people actually reaching out to teachers across grade levels to see what strategies they've employed to help with their students masking, and especially masking? That's one of the questions that came here. Do you have any ideas?
Yeah, well, this is my other hat, right? Not the Mass League hat, but my civil rights, social justice hat. We know that the teachers unions, whether it's BTU, Boston Teachers Union, and the other groups that are organized around what's happening in our schools are talking and they're communicating. I was with a group of teachers just Saturday, and part of that conversation is around masking and what they're doing to communicate what's working in classrooms. So there is, whether it's formally or informally, teachers, administrators are sharing their stories. I think about my son. Last year, my son was a graduating senior from Brockton High School, and he played a season of basketball with a mask on. Who would have ever thought that you would play basketball with a mask on your face? And when you see these folks down south screaming as if their child's life is going to end because they got to wear a mask during the day, and I think about my son. They did it because they understood that it wasn't just about them. It was about their classmates. It was about their grandparents, like my mother. And what they were doing was trying to protect themselves and protect their family. So I think there's a lot of strategies that are working in schools. We just got to lift them up and maybe highlight some of the teachers and schools that are doing it well. Lift up their stories as a model for the rest of us.
Mm-hmm. Is there any way, Dr. Madoff, that the state or any of you could get that input from teachers so that they will feel heard, and or they may already be doing this, that they have input, that they are being listened to? Because one of the chats or questions was that some teachers are saying very much different things than you're saying, Dr. Madoff, about the mask. You said our kids adapted, and this statement says some teachers say that kids are not adapting to the masking in a classroom, and that may be anecdotal. What can we do to hear more from teachers?
I think that's a great idea, and I know that our Department of Education is listening very hard to teachers, and I think we at DPH can do more of that. So it's a great suggestion.
That is a great suggestion. Thank you, Reverend Gloria.
I don't know that we've actually talk so much about vaccines and the effectiveness in kids versus adults. So what do we know about vaccines? Effectiveness, side effects, what's the latest word on boosters? Is that you, Dr. Callahan or Dr. Madoff?
I think the effectiveness has been, I don't know that, I do not know the numbers. I know that they are as effective as for adults. And as Dr. Madoff mentioned, that they're, I think it's Pfizer that will soon be coming up with a vaccine that has been tested. Moderna's testing about 4,000. They're only on the second dose of those 4,000 children. But I'm sure, and then there's a third vaccine. There's several vaccines that are coming up, trickling up by different methods, okay, different technology. Some, we didn't talk about this, but I want to name it because I know there are people listening, that there are many people who are not anti-vaccinated. They're not anti-vaxxers. They are a little bit concerned about the new technology which was used for this particular vaccine and the rate, the quickness of it all. So I just name it and put it out there because it's a very valid concern, and I think that people should feel free to ask it. But what I'm seeing is that there are actually some vaccines that are coming out that are using some of the more old school ways and hoping to increase the vaccination rate by offering vaccines that are generated by some of the old school ways. But you know, I think that the efficacy is good. The big thing about kids is a lot of them want the vaccine, and those in the 16 and above range who are not being vaccinated, a lot of times I'm finding it's that the parents have not allowed them to get vaccinated. But in asking them, they would love to be vaccinated, and they do agree that it is effective, and they're open to it, but the parents are still a little hesitant to do it. So, you know, side effects. Children aren't little adults, but in some ways they are. So they have the same achiness and they can be febrile after a vaccine because the fever is actually part of our immune system. And what we are doing is triggering the body to respond. And part of that is to generate those antibody producing organs in our body. We get large lymph nodes. Some people complain of really large lymph nodes in and around even the vaccination site. But these are all temporary. And we have to mention that there were cases of cardiac transient cardiomyelitis gone with some treatment. Most of the time treatment isn't even necessary. But to name that, those are some rare but side effects that are out there. But generally, people do just fine after the vaccination.
Dr. Callahan, I'm going to pick up on one thing you said about sometimes it's the kid who wants the vaccine and the parent doesn't want it. We had a situation in our trauma program where a mother eventually took the vaccine because her daughter mentioned it to her. Her daughter was the one who kind of talked her into it. What advice would you give to young people, if they're on the line, about handling that? If my parent doesn't want me to get it, I can't get it.
It's a tricky situation, but it's actually the way in which you handle that is the way in which I feel that we're not doing such a good job. I am not about persuading anyone to do anything. I am about trying to educate and give people the data that they need, the information they need to make well-informed decisions. If you come at people too strong about trying to coerce or convince, it doesn't work. It hasn't worked, at least in my experience. And so in talking to, I've had many parents where the child is sitting there, they said they want it, and the mother is saying, no, I want to wait. I want to see what's going to happen to all these people that got vaccinated. Are they going to, something going to happen to them down the road? I'd rather wait. And what I try to do is build a setting for a conversation between the child and the parent. And I try to do that for a number of reasons, because they are learning, especially the 16, 17-year-olds, how to negotiate, right? That is the skill that we want to teach our young people anyway. We want them to be able to think and be critical thinkers and to be able to talk with someone with a different opinion. So you have that set up right there. You've got a parent that doesn't want it, and you have a child that does. And so what I do is try to facilitate that conversation by asking questions about, why it is that they believe or want what they want. And it takes time. It takes a long time. I was at an event that was doing a vaccination outreach, and there was a woman whose cousin didn't want to get vaccinated, and her husband didn't want to get vaccinated. The grandparents didn't want to get vaccinated. And this one sole family member was the only one that was vaccinated. And so I spoke with her, and she goes, "What do I do?" I said, "Call them. Let's have a conversation." I think I spoke with them for an hour. It sometimes takes that long. But in the end, those conversations led to the vaccination of the father, of the 12-year-old child, of both grandparents, all in that same event, because of a conversation and negotiating and talking about what it is that people really want, what it is that they're concerned about, and really addressing those questions, taking the time to do it without shaming them. So I think all of that it's a challenge, but it's not insurmountable. And I see that young people do talk their parents into it, or in a sense. They do come to a conclusion that everybody walks away happy with.
Just to kind of further the discussion, I think everything Dr. Callahan has said is accurate. And I think research pans it out. Research shows that when you are trying to change someone's mind, if you go in and tell them this is why you need to do it, people shut down. In fact, when you allow people to tell you what they're concerned about and you sit and you talk to them, you're more persuasive. And so if you're really trying to change someone's mind and convince them that your opinion about the vaccination is in fact accurate, saying to them, these are all the reasons you're wrong, just shuts down lines of communication, right? And so if you're trying to talk to people, you have to be open and honest and hear what they have to say as well. And that's how change happens. And it doesn't happen overnight, right? So you can't expect that one conversation. It's usually conversations with people, first of all, that are trusted, people that are from their communities. And it's oftentimes multiple conversations over time that actually impact change and result in someone doing something different.
Michael, if you had not taken the vaccine, and I know you have, could your son talk you into it? It sounds like he could.
I got 3 sons, a 13-year-old, an 18-year-old, and a 26-year-old, and they're all persuasive. So they tend to come with more information than I have, Dr. Madoff. They listen, they debate stuff in school. So yes, I think, again, to that point, it's not just about kids convincing kids, it's about kids convincing adults too. Because sometimes even adults are not as have as much access to this information as we think they do. My mother does not necessarily surf the web, but having my kids that she engages with on vaccinations or booster shots, these conversations are happening in my household, even around me. So yeah, I think kids are powerful as a solution in getting information out, and my kids are examples of that.
From Gloria?
Yeah, so I do want to, again, reminding ourselves about parents, and we've got parents on the line now. We've talked about a lot over the last hour. What's your top tip for the parents who are listening in? Coming from your different perspectives, a public health perspective, a practicing pediatrician, a mental health clinician, and a public health guru, Michael Cory. What's your top tip?
I'll throw one in there, which is to remember that your kids are listening and watching, and it's often surprising. They don't seem like it. They seem like they're not paying attention, or they're ignoring you, or they're contradicting you. But they're watching and they're listening, and you'll be surprised, in a week or a year, that what they've picked up.
Great. Yep. Thank you.
I echo that, Dr. Madoff. They are watching, and they start watching at age 9 months, age 2. They actually assume a lot of the stress that you bring to the situation. They actually will respond to that, not a clue what's going on, but they feel the tension from you and they will respond accordingly. So part of mine is that for parents to take a deep breath, breathe. Take a deep breath and breathe, and know that that the conversation and that the relationship is central. The relationship that they have with their young person is central. I'm sure, Dr. Cory, that you have established a relationship with your sons over the years, pre-COVID, pre-anything, that you're a trusted voice. And so for parents to understand that all the work that they've done, parenting up to now, they can breathe and they can rest on that, and know that their young people, yes, are watching, and that they really do want, they want the best for themselves as well. You don't carry that burden alone.
And maybe if I can chime in there, is I think, we take this for granted because we're all really busy adults. And then we have kids who are really busy kids. And if they're not working, they're playing video games, right? Which my kids are big gamers. Is something really simple, which is to be intentional. Sometimes I close the laptop, though I have tons of work to do, and I'll go and I'll just get in their bed, right? Even as a dad, I'll just go crawl into bed and then I'll have a conversation with them. So there's no stress that they didn't clean their room and all these other issues that tend to get in the way of conversation. Just get into bed with them and have a conversation. How's school going? What do you think of this COVID thing? How are you feeling about vaccination when it's your turn, when they have young people? And we sometimes, that seems like a real simple recommendation, but we don't talk enough in families because we got so much going on. And I think I try to be intentional about it. I'll just, close the laptop, turn the TV off, and turn their video game off, and then go just have a conversation. And it really works with my kids. I'm not sure everybody it'll work the same way, but it works with them.
Thank you.
Dr. Atkinson?
Yeah, I just like to remind people that, children oftentimes, they want reassurance, when as parents, they feed off of our energy. And in this time of COVID, there's been so much hypervigilance, so much fear, so much trauma, so much anxiety that's happened. And so for all children, regardless of their age, reassurance, tell them that they're going to be safe. You're not going to lie to a child, but they want to know in the end that they're going to be okay, that their well-being will be okay. And they look to adults in their life to see if that's actually okay. And so the way we respond to difficult times, they take those cues from us. And so it's not about lying or being deceptive, but if we're not taking care of ourselves, if we're completely a mess, if we're constantly stressed out, if we're worried about every aspect of this, kids feed on that. And so we have to be really intentional about how we respond to the fears that we have. This is a scary time and there's so many things we don't know about, but they take cues from us. And so really being intentional about how we respond to our fears and how we model those behaviors for children.
Anyone else with the tips, or did we give everyone an opportunity? Reverend Gloria, do you have a tip or two?
Yeah, as I listen to what each of you has offered, there's a preacher in me that's reminded of a text in the Hebrew Bible. It says it's when Moses had been called by God to be the one who would lead the people out of slavery, and he was reluctant. He felt like he couldn't do it. And when God says you can't do it, and he said, well, I don't have, how am I going to do it? What are you going to get? What am I going to use? And God essentially asked him, what's in your hand? And of course, the tools that he needed were in his hand. But and I think that's the point here, that as parents, we know our children, we love our children, we're confident in that, and they're confident in us. And so really the things that we will need to lead all of us through this difficult time. Who would have thought, it's a year and a half, who would have thought we would have made it this far, but we've made it this far. And what the things that we need are in our hands, and our collective hands, obviously, as a community as well. We will get through this.
Those are wonderful words, and it would be a perfect ending, except for I have more questions. Thank you, Reverend. We know when the preacher starts preaching that it's wrapping up time, but I want to just throw in a couple of more questions that I see in the chat. And these may be repetition, but I think it's important to repeat. Are there any free resources for rapid testing for children in the Boston community? Anybody want to take that? Are there free resources for rapid testing for children? Anybody know? I don't know. You can go online.
Right. I was going to say that their website, the state website on testing resources, is very complete. It's got hundreds of places that you can go for a test, and it will tell you what kind of tests are available. The other thing I would mention is that you can now go to your local retail pharmacy and buy a rapid COVID test. They're not as cheap as I'd like, but they're under $20 now for 2 tests, I believe. And you can get that at any local retail pharmacy, and they're quick and they're not hard to do. You get a result in 15 minutes, and you can act on that result.
So yeah, and the new news is that I just finished coming from the pharmacy, and they are out. They're one of the major manufacturers assumed that we were over COVID and laid off their workers, and then discovered that COVID was still with us and has not been able to hire the workers or to gear up to make the home test. So it is hard to find them. I think you were looking for them too, Reverend Liz.
I was looking for them, and it's hard to find. You might want to call, and I would assume this is that supply chain issue generally. And so we just keep checking on this one. But thank you, Dr. Mata, for that information. I have some other questions. And again,
Reverend Liz, if I can just jump in terms of the testing.
Please.
Because a lot of times folks will want to test the day that they heard that they were exposed. And so a lot of people will test too early and get a negative. So I just to let people know that actually, if your child was exposed on day 1, testing them on day 1 is probably not the right thing to do. It will not really be positive for another 4 to 5 days, 6 days. So just to keep that in mind in terms of rapid testing.
absolutely. Absolutely. Did anyone else? I don't want to step on. I had some other questions. And this is kind of outlying, but it's still impact. Can pregnant women pass on COVID-19 to their children, to the child in utero?
Well, yeah, I can try to answer that. There doesn't seem to be any evidence of that kind of what we call vertical transmission. It doesn't pass directly from the mother to the baby. But of course, if the mother has COVID when the baby is born, then they can expose the baby. The other thing that this just brings to mind is that the mom's immunity to COVID also goes to the baby, does go to the baby, and does pass while the baby is still in the uterus. And so if the mom is vaccinated, which we, again, highly recommend, pregnant women are at higher risk of bad disease from COVID, and there's no reason a pregnant woman can't get vaccinated. It's safe and effective in pregnancy. And those antibodies that the mom develops go right into the baby and will protect the baby for a period of months after the baby's born.
So then the next question behind that is, what about breastfeeding moms? Should they be vaccinated?
Yes.
Yes, again, it's totally safe and effective in breastfeeding, and breastfeeding also passes antibodies to the baby.
Dr. Callahan, I think you mentioned this back a while ago, but I'm just going to ask for clarity. What about kids with underlying health conditions? Where do they fit in the whole vaccination thing? Should they be at school at all? Should they be, the same question we asked about adults who had other issues?
Yeah. So as long as the school is taking the precautions that they are supposed to be taking, yes, they should be in school. Absolutely. Underlying conditions, I'm assuming you mean like asthma. There are some hemoglobinopathies, sickle cell trait, sickle cell disease, You know, these are all very, very serious illnesses, but yes, the children should be at school. The children should be vaccinated. There are actually, if possible, there are actually very few reasons to keep a child at home because of this. If people at the school are doing the things they need to do. Even young people who have autism and have difficulty keeping masks on, you know, certainly the recommendation is that those kids don't all have to stay home. You know, there has to be more hypervigilance in testing and in screening. But there are a handful of kids that will not tolerate a mask. And so for those, that's I see that as an underlying condition that is really is impacted by COVID in a marked way, because they just will not want it on their face. They can't, they pull it off. And actually our asthma patients did very, very well. Even those who had COVID, a lot of the young people that that tested positive, that had baseline asthma, mild to moderate asthma, did okay. Those who were on steroid inhalers, we worried about them for a while because that we thought about the effect of oral steroids reducing the immune ability to fight infection. But what we're finding is that with inhaled steroids, that actually is not so much the case. And so they were able to continue their preventative inhalers with inhaled steroids. And they did well. We didn't talk much about long haulers, but I don't know if that is going to come up at all in terms of being an underlying condition post-COVID. But there are some young people who have chronic fatigue and brain fog and all these other symptoms associated with what they feel is is an incomplete recovery of COVID. Some kids can test positive for weeks afterwards, even though they don't have symptoms. Some of them can test negative and continue to have symptoms. So it's a mixed bag in that regard. But they too, you know, like I said, I think the question is whether or not there are underlying conditions that would force young people to stay home because of the situation. Even those who are severely immunocompromised by a genetic disorder, we find it's very important for young people to go to school and to be with their peer groups. As the classrooms would need to be smaller, and there has to be vigilance in screening for COVID.
Okay. I'm going to re-ask another question. And Dr. Madoff, I think you started with this. When are the vaccines going to be available for children under 12?
So we don't know the answer to that. And we haven't, the Pfizer company announced that they have positive results in that age group, but we haven't seen the data yet. You know, there's a long and involved process and review of that data by the FDA and then by the CDC before it is recommended for children. So I can't say yet. I think, you know, in the most, you know, I'm hopeful that these vaccines will prove to be as safe and effective in younger children. I think they will. But I think in the best case scenario, we're looking at least a couple more months before there could be an approval, and maybe longer.
Yeah.
Okay, well, Reverend Gloria, you need to get that second sermon ready because we're getting ready to wrap up. But I do want to say that I have a question. I think, first of all, the teachers need to be saluted over and over and over and over again, because teachers have really, I don't know how you've done it, but you've really, you know, stood the gap and really under such incredible, you're frontline workers. That's what you are. So we want to thank you. But I have a question to all of you. Do you think that remote learning is really considered a failure because of all the frustrations, particularly in our community? I don't know generally. What do you think about the whole notion of remote learning now? Because it didn't work for a lot of kids, at least in my community. Anybody?
Maybe I'll chime in just from a broad perspective on remote periods. So, you know, I've said we had to teach remotely, provide healthcare remotely, work remotely. And we were forced to do it, right? We weren't that receptive to working remotely until this pandemic. We weren't receptive to teaching remotely until this pandemic. And quite frankly, as the doctors on this call know, we were resistant to providing healthcare remotely until this pandemic hit. I think what we found in all those spaces is that we fumbled doing it, right? That we learned a lot. We didn't always do it well. We had to find the right systems to do it. And our kids were experiencing those same challenges. Many of them, whether it's broadband Wi-Fi, whether it's the home didn't have the right structure in place. Even, I made a joke online on Facebook that I walked in my son's room and he had turned his closet into an office. So imagine, I saw him sitting in the closet and he had made it into an office. So we didn't even have the right infrastructure to do all this in our homes. And then, the schools didn't have the right equipment. Teachers didn't have the right training to teach remotely. So I think we lost, I would argue, even for my kids, lost some learning time and some quality learning time. But this was an opportunity, right? How do we make sure we can be back in person, but also do remote going forward in a way that serves all kids? There's opportunity there if we embrace it. If we prepare for it, if we resource it, we can reach kids in a way we've never been able to do and extend learning days and do some pretty exciting things, but we got to be ready, willing, and able to do it.
Excellent, excellent. Any other thoughts on that?
Agree, 100%.
I think we are all agreeing. I think, we preach about the Kairos moment, Kairos being a moment of great opportunity, a moment of great peril, but great possibility. And I think that's what this moment is for all of us. As horrible as this moment is, it is a moment of great possibility. I want to thank you all, Reverend Dr. Gloria, Dr. Madoff, Dr. Atkinson, Dr. Callahan, and Michael Cory for answering our questions. I want to thank everyone who's been listening tonight and engaging in this conversation. And again, we want you to know that this town hall has been recorded and will be made available free of charge. All you have to do is go to our website and you can get this. And we suggest that you do that because we have seen that there's more life to this and you can listen more closely to the answers and you can pass this on because this was important information. It will be made available. The website is www.rpcsocialimpactctr.org. And one of the questions that came up was, are vaccines being offered at schools? And we just wanted to give you this announcement on September 24th from 9:30 a.m. to 5 p.m. A Community Academy of Science and Health and the Boston Arts Academy High Schools are partnering with the Boston Medical Center to host a COVID-19 vaccination event. This is free. Individuals 12 plus are eligible to get vaccinated. Pfizer, Moderna, Johnson & Johnson vaccines will be available. Information and consent forms for minors can be found by going to www.mass.gov to learn more. You can also go to bmc.org. And of course, the message for you all is to be vaccinated. Get vaccinated. It is critically important. We want to, again, thank you for joining us. We invite you to join us virtually every Thursday from 6:30 to 7:30 for Can We Talk? We are online, community conversations on trauma. We talk about our pain. We talk about getting through this, and we talk about community. To learn more about that, www.rpcsocialimpactctr.org. Reverend Gloria, you got a sermon for us to get us out of here?
No, I think you already did it, Reverend Liz. Thank you so much. You thanked everybody else, but we want to thank you for your leadership and your vision and just being who you are.
Well, God bless you all. Be safe, everybody, and we'll be talking again. Thank you all. Good night.
Take care.
Good night.
Good night.
Good night.
Thank you.